We're live. Good morning. This is a joint hearing between Senate Health and Welfare and House Healthcare. It's February 5th, hard to believe. And we're in a bit of a celebration today because this is the first time that room 11 has been available to us since it was, since the renovation's been going on in the State House. So welcome, everyone. It feels good to be here instead of walking across the way to the Pavilion Building. This morning, we've got two really important and informative folks with us, Elliot Fisher and Chris Kohler. And I'm going to let them introduce themselves in just a minute. Before we do that, first on the agenda is for us to introduce ourselves. And then Representative Black and I will make a short comment, and then we'll begin the meeting. So we'll start over here with you, Senator.
Senator Larry Hart, Orange County.
Same votes from Orleans County.
Debbie Powers, Waterford, Barnett, Reigate.
Alan DeMar, Enosburg, and Montgomery.
Woody Page, Newport.
Topper McFarland, I'm from Barrytown. I represent Barrytown and Williamstown.
And I'm Alyssa Black, and I represent Essex Town.
Ginny Lyons, Chittenden Southeast, Senator.
Senator Martine LaRocque-Ulick. I live in Burlington and represent Chittenden Central.
Leslie Goldman, Wyndham 3, which is the Bells Falls area.
Representative Mari Cordes. I represent Lincoln, Bristol, Moncton, and Starksboro.
And Representative Lori Houghton, I represent Essex Junction.
Matthew Critchlow, I represent Colchester.
So good morning, everyone. We've been looking at, both committees have been looking at the work that we've done on Act 167, which is going on now since 2022, and very excited about that work. At the same time, we're very concerned about the crisis that we face in our healthcare world, in particular the cost of healthcare. And so we've started taking testimony, each of us, each committee, on the cost of care and the regulatory environment that we need in order to reduce those costs. We heard yesterday, our committee heard yesterday from the Green Mountain Care Board and the Agency of Human Services, and we'll continue taking testimony from folks who can help us with our own in-state solution. However, it's really very important that we learn from what other states are doing. And we also hear about the regulatory environment that we face and what we might do here that will improve outcomes for the state in terms of cost, quality, and access. So I've invited, it's not doctor, Chris Kohler, Mr. Chris Kohler from the Millback Bank Memorial Fund, who I think many of you are familiar with, do a great deal of work on informing us about healthcare issues overall, to talk with us about what other states are doing. And then someone you may be more familiar with, Elliot Fisher, Dr. Elliot Fisher from Dartmouth, to speak with us about some of the issues that we're facing in healthcare policy. So I'm going to let Alyssa say a few things, and then we'll work together to listen to folks who are here with us.
Yeah, and I want to thank Chair Lyons for facilitating this and frankly coming up with the idea. We've been taking testimony for 3 weeks now, sort of from individual pieces within our healthcare system and the crisis that we're facing. And I'm really looking forward today to have sort of a perspective on looking at the whole system of care and also looking to other states, you know, to see what they're doing and getting ideas for how we can put this all together, work all together and deal with the crisis that we seem to be in.
So thank you. So good. And I do want to introduce David Merman, Green Mountain Care Board member, who is here, and also Brendan Krause, who is here from AHS, the Director of Healthcare Reform in AHS. we'll see how it goes, maybe offer some comments or join in with conversation. My goal today, I think our goal today is to listen and hear what you folks have to say. And then we'll have some time for questions. I think there's sufficient time for all of us to engage and ask questions for clarification and additional information. Not going down any rabbit holes, but definitely filling some gaps for ourselves. So, welcome, Dr. Fisher. I think you're due. Why don't you both introduce yourselves? And are you going to coordinate together or one then the other?
See each other.
All right. So why don't you introduce yourselves for the record?
So, hi, I'm Elliot Fisher, live in Norwich. And it's quite a month since I've reading cell phone number. I'm embarrassed by. But I moved to Vermont 40 years ago to become a primary care physician in the VA, the trainee of policy. Speak up.
Thank you.
Excellent. Can I ask the same of you? Because my hearing aids are never perfect. So, thank you. And anyone else, if I don't speak loudly, just raise your hand or interrupt me. So I'm Elliot Fisher, practiced primary care at the VA for 20 years, but a lot of my life has been focused on understanding the causes and consequences of variations in poor health system performance and what we can do about it. My formal title is Professor of Health Policy, Community and Family Medicine and Medicine at Dartmouth. And I think that's sufficient.
And I'm Chris Kohler. I'm the president of Millbank Memorial Fund. I'll talk a little bit about the fund in a bit. Given what Elliot's saying, I'm a resident of Rhode Island, but a frequent visitor in Vermont. I'll talk about that a little bit. And my own background is I've been president of the fund for 12 years. Before that, I was the health insurance commissioner in Rhode Island. So I regulated.
Put another microphone in. Oh, give me 1 second.